We're going to fund national health care without income taxes, and yes, I'm completely serious. Hello, my name is Lisa. I am here to talk to you about something I never thought I would be talking to the public about. National health care. That's right. I have figured out a way that we are going to pay for national health care without income taxes. That's right. Now look, I have never been passionate about national health care, but I've noticed that more and more people are, and in addition to that, more and more people are being broken by having to pay to live. Like that's all they do is work to pay to live. And at some point, when we have this much money and this much accessibility to modern medicine, this has got to stop. In America, we don't need people unable to work because they're sick. We don't need people not having lives because they can't afford the sickness they have. We have a lot of problems with the healthcare system, but I know most people are going to be against a national health care plan if it comes out of our income taxes. Americans are at the point where they already feel like they pay too much in income taxes and they don't want to fund that. That's what got me thinking. And I'm going to give you a little bit of backstory about myself before I get into this plan for how we're going to fund national health care without income taxes. And yes, I'm completely serious. See, I am from Tennessee, a state where we do not have a state income tax. That's right, we pay federal income tax, but when it's tax time, we don't have to do state taxes. We don't owe the state taxes. Money is not taken out of our check for state taxes. So how do we fund everything here? Well, oh, by the way, you're going to hear my cat, Mindy. Mindy! She is good luck, and she is very excited about what I'm talking about, so you will see and hear her. I'm from Tennessee, and we use sales tax to fund everything. Now, our sales tax is high. It's like at 9.25% for most purchases, okay? That's a really high sales tax. This means if I go to McDonald's and I buy a $10 amount of stuff, I'm paying generally another extra $1, about 10%, on top of that to fund things in this state. Now, that much of a tax nationally, a sales tax, would be kind of crippling to the average American because we're already paying a lot in income tax. That amount of money added on top of what we already pay in income tax would not be very good for most Americans. Most Americans wouldn't be able to afford an extra 10% surcharge on top of everything when they're already paying state taxes, they're already paying federal taxes, they can't afford it. I know healthcare is coming. People want this. Slowly, people are being turned on to this idea that we need some kind of national health care besides Medicare that benefits the average person. Now, as I've said, income tax isn't going to work. Sales tax also not going to work. Okay? So I have two income streams, two major income streams we are going to use, well, three technically if you want to talk about investments, because we're going to have to take the money from the first couple of years of these income streams and invest it to gain more. Now, my goal is for all this to be enacted by 2030, that we take the first few years of this money, we invest it, and make a great big pot to start this national health care with. A few caveats. When it comes to something that's free, first of all, it's never free. We got to pay for it, obviously. But when it comes to something that's free, it's not going to be the fancier health care you're used to. It's just not. A little story here, and I'm getting to the point. We have something here called Remote Area Medical. It's a charity, basically. And they go out to poorer rural areas, and they give free health care. People stand in line because they can't afford to do it on their own. Okay, we're at this point where sometimes people will stand in line for a day to get their tooth pulled just because they couldn't afford it. I'm talking about getting a tooth pulled here, guys. That's something that could kill you, but a lot of people can't really afford it, or it breaks them, and that's not that expensive compared to other dental work. The point I'm getting to is this. it's not going to be what you're used to. If you have private insurance and you have a real bad toothache or something, what's probably going to happen is you're going to go get a root canal, and you're probably going to get laughing gas and all kinds of good shots to make sure you don't feel anything, and then they're going to put a beautiful crown on top that matches your other teeth perfectly. Okay, that's what people are used to here in America if they have insurance. Now, when it comes to free stuff, instead of giving you this expensive root canal, they might just pull your tooth, because they don't always have the budget at something. And I'm using remote area medical as a sort of an example here. But if you went to something like that, they might pull your tooth instead of giving you a root canal, because it's what they can afford to do with the budget that they have. There's no spending on things that it doesn't have the budget to do. So you might get your tooth pulled instead of the fancy crown that you would get with your own private insurance, or paying thousands out of your own pocket like most Americans can't afford to do, or many. So sometimes the free health care is just not as fancy. Now, we have another problem. Private insurance. The private insurance industry. This is a huge industry that employs tons of people. We don't want to see it go under. And we also don't want to screw them over. Do you know why? They have very powerful lobbyists who will kill this plan and it will never be seen. We need to make sure they stay in business and that people still buy from them, in addition to providing a safety net for everybody who can't afford to get their tooth pulled. Okay, and do you know what happens if you have an infected tooth that you don't do anything about? It could kill you. That's a really drastic thing to happen to someone, that they might go to the hospital in an emergency and have to pay for it the rest of their life because they couldn't just afford to get a tooth pulled. Okay? This is what national health care is for, to help people in situations like this so that they aren't crippled by these bills for the rest of their life, economically crippled. Okay? I have the plan to raise money. Okay? And like I said, we have powerful lobbyists in the insurance industry that are going to want to shut this down. And speaking of politics, I am not running for political office. I am not a politician. I am trying to sell you this as an idea because I believe in it. And because I haven't heard anybody else coming up with a good concept. We need a way to pay for this besides income tax, because it is never happening if it comes from income tax. It will get shot down. People don't want to pay that, okay? That's the reality. So we got to fund this some way outside of income tax. And that's the plan that I have. I am not a progressive. I am not a Republican. I am not a Democrat. I don't believe in any of that. What I do believe in is that the citizens have a need, and we can fund that need as a group, all living together. The other citizens are not your enemy, they are your neighbors. And we are all in this big tribe called America, and we have to make sure everybody in the tribe gets taken care of the best we can. Health care that's free is not what you're used to. Longer lines, less budget. It's not the luxury health care most Americans are used to, with a beautiful waiting office with all these TVs and blah, 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 blah. Those doctors will still exist. They're not going anywhere. Okay, we're going to make sure the current industry stays good, or else this will not happen. National health care will not happen if the normal industry cannot maintain. Okay, too many people are employed, and like I said, powerful lobbyists in these big industries. So we got to make sure the medical industry still is able to make its money, the insurance industry is still able to make its money, while funding something for the people that doesn't come in the form of an income tax. So here, I'm finally getting to the point, y'all. Here's how we're going to fund it. 2 primary income streams. One of them is a tax. Sorry, but it is not an income tax. It is not a sales tax, and it is not a value-added tax. Not. It is a transactional tax. A penny. A penny transactional tax on every single retail purchase all day long, every day in America. That means if you are buying a $9.99 item, it is now $10 even. Okay? The penny is negligible. I know a penny is a lot of money. It can be if you're poor. Seriously. It may not be a lot of money to you, but to somebody it is. Okay? They're picking pennies off the ground trying to get something to eat today. This is a real thing. Okay? The penny transactional tax will happen on every retail sale in America, every sale in America, but it's not a value-added tax. So let's say you go get a bean burrito for $1.29 at a fast food place. That bean burrito is now $1.30, 1 penny. It goes up incrementally in small amounts. When you get to $1,000, it's $1. Okay, so if you pay $1,000, there's an extra dollar that gets tacked on this that goes to healthcare. If you buy a bean burrito for $1.29, and it's now $1.30. This is a very negligible amount of money to you, the consumer. It's not like a tax, it's not a value-added tax, and it is tiny. You will not notice that penny. If you are paying $5.49 for something, you are now paying $5.50. Okay, if you buy all your items together and it costs $29.99, now it's $30. If you buy them separately, you'll pay a penny on each one of those. The average American can afford this, okay? And like I said, if you're buying a $1,000 item, it's now an extra dollar. It's $1,001. Okay, so this is a very negligible tax, but there's a beauty to this. It means everyone in America, no matter whether they're just visiting or not, no matter whether they're a citizen or not, if you're here on the grounds of America, you are paying into our health plan. Now, there's a benefit to this. The penny transactional tax gets money off of everybody in America. When Affordable Care Act was passed, there were people claiming that the illegal immigrants ruining the hospital system, blah, 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 blah. They don't pay taxes, yet they get to use the hospital, whatever. In this penny transactional tax, and as I said, it'll scale up to like a nickel at 100, whatever. We'll have somebody do the math. But right now, for all intents and purposes, it's a penny transactional tax on all retail transactions all day long in America. Okay, this means that if you're an illegal immigrant, you're paying into it too, that 1 penny. Okay, so everybody who wants to bitch about illegal immigrants getting something, blah, 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 well, they're paying into it too. Whether they get to use it or not, everyone, even a tourist, will be paying into this. Okay, so it's going to be funded by everyone in America physically, and this is a good thing. Okay, now, the next stream of income is a lottery. Here in Tennessee, we have Powerball and Mega Millions. And when they started having the lottery, because of course, this being the Bible Belt, it took a while to get it going. When they started, we only had Powerball. And when Mega Millions came, I said, does anybody really care for 2 of these? Yes, and they both get played all the time, okay? In Tennessee, it's how we fund scholarships and stuff for college. These generated so much money, these lotteries, those 2, over time, that now if I wanted to go back to school as an adult with no degree, this state will pay for it. I have to go to a community college of their choice, because when it's free, you don't always get to pick, you know, I don't get to go to Vanderbilt for free on this, but I can go to my local community college and get myself a degree free. Because over time, that these lotteries have raised so much money for education, they're now able to add this on, and that's how our plan for healthcare will be too. We're going to start by funding the most basic stuff, and as the money grows, we will be able to add things in, dental, whatever, okay? Not done. So, this lottery will be comparable to Powerball and Mega Millions. It will have huge prizes and be nationwide in all states, okay? If they want the healthcare, they got to participate. Now, the federal government will have to loan, and it will get paid back as part of the thing. It will have to loan the money for setup. There has to be initial prizes. There has to be all the tickets printed. There has to be all the terminals made. A lottery costs money to start. So we're going to have to borrow money from the federal government to do that, and we can pay it back with interest. This is where the federal government comes in. We're able to get the money from them, and then over time pay it back. Now, all the while this is happening, the lottery is selling, generating money, generating money, generating money. And as I've said, there is room for this 3rd big lottery. And it's been such a moneymaker here in my state, they've added in more programs for people. Like I said, you can go back to school as an older person and it's paid for to get that degree. That didn't happen at first when the lottery started and they were collecting money for education. Over time, it generated enough money for this to happen, okay? So this is how it's going to be with the healthcare lottery, and all the proceeds will go into the healthcare fund. The initial money from the first few years of the retail transaction tax and the lottery are going to go into investments. They will have to be invested to grow for the first several years. We cannot start the healthcare without a big, huge pot of money to start working from. It may only provide the most basic things at first, okay? Maybe insulin at a good price, things like that, okay? This is what it's there to do, is to help. The insulin's a perfect example. It's a drug that's not that expensive in other countries. It's expensive here. Maybe if we had a bulk buyer from the National Healthcare Plan, we could get a little bit better rate or something, right? The point is, you'll have some bargaining power and a way to fund it. And there's going to be investments for the first few years, okay? I know that's a while off, but we got to come up with a huge pot of money to facilitate this. So 2030 is the year, okay? You have the penny transaction rolling in all the time in perpetuity. That's going to put up a lot of money. You have the lottery, and then that's going to generate tons of money. All this goes on investments. Then we start healthcare. Now, what about insurance? How do we keep them from stopping this from happening? Well, they're not going anywhere. People are still going to want private insurance, okay? The reason why, not everybody wants the free health care or needs it. Most people would rather have the nicer health care. But we're going to start a whole new industry for the insurance business of selling supplemental insurance. So let's say that you're someone who wants a choice of doctor instead of the one that healthcare makes you go to, because that's going to be the reality of it, okay? There's probably going to have doctors you have to go to, you may have to wait to go to them, and they're not going to be the fancier luxury private doctors we're used to. And maybe your doctors aren't fancy, but it's still expensive. Well, this ain't going to be fancy either, okay? It's just going to be cheap or free. And it's not going to give you anything like plastic surgery, obviously. We all know this. Okay. But it's also not going to do things that are cosmetic. It may not give you the beautiful matched root canal when it could just pull your tooth. This is the thing I'm talking about. Most of you are still going to want private insurance so that you have the ability to do what you want. So we encourage private insurance to keep going in private doctors, right? The thing is this. We need it to be attractive to them as well. So let's say that you are going to use the national health care, but you bought some supplemental insurance from someone in the insurance industry. You can use that to scale up on the things you would normally do. It's provided as a service for free. Well, now you can get the better versions because you paid in for supplemental insurance. Things like that. Okay, we need to make this attractive to them by selling ways that they can make money off it too without screwing over the people. The people have to have this medical care. It's beyond the point of saying no anymore. Okay, but income tax is not going to be the way to fund it. People don't want that. Have you guys heard a better plan than this?